Okay, so first of all, today we are doing Annalise, who is a 50-something-year-old, had been very, very healthy and now developed in the last 15 years some autoimmune problems, and MS being the number one, Sjogren's a very severe case. So we have to be very careful what we're putting in your body. You are immunosuppressed because of some of those medications, but that is not a contraindication for using exosomes. Plus, these exosomes have been tested for all the FDA required, the list of viruses and communicable diseases, but also beyond that, which is important with MS, is your JC titer, and I prefer an Epstein-Barr virus titer. So that's really important in your scenario. What we use is a simple nasal spray. This is called an aerosolizer, MAD nasal aerosolizer. So this tool basically allows me to push liquid through, and then it creates it just like any old Afrin nasal spray. The key with this is what we were talking about, the direction of the administration, so that we can cross across the cribriform plate and into the brain, ideally. Even if it sits in your nasal sinuses, it's going to get there. But that's the goal of doing an intranasal procedure. In this particular case, for one, we have more testing being done on these. These are newer products, so we have more advanced testing being done. There are things that may develop that we aren't currently testing for, such as in 2020. Prior to that, we hadn't been testing for COVID. There are going to be new viruses, new things. There are things that we can't guarantee are going to turn up later. But when someone's immunosuppressed, it's very important that you're protecting them from as much as you can. With MS in particular, there's something called a JC virus, which is ubiquitous. All of us have probably had that or been exposed to it. However, it has been shown to be harmful in immunosuppressed patients, especially those with MS. So we want to protect any MS patients from using a product that has that. Now, we're trying to get that done for the human cell and tissue products, but as of yet, those tests aren't being done, whereas with this exosome product, it is being done. And so I feel much safer giving that to her. We are trying to get specifically to her brain where there's damage and inflammation. And the exosomes are just as powerful at delivering the anti-inflammatory activity, the growth factors. The biggest one in the brain we want is BDNF, which is Brain-Derived Neurotrophic Factor. And these exosomes are very high in that. A lot of times I'll pair, especially for brain injury, whether it's, trauma from car accident, boxing, football, or like a degenerative disease. Either way, we try to do multiple tests and then use other treatments to augment it, such as hyperbaric oxygen, things like that. So in any patient with MS, which is neurodegenerative, and we're delivering product into the brain, you would want to choose something that has been rigorously tested, followed all the rules, and has all the updated testing. Previously, over the last 10 to 20 years, there was a small list, and that list of testing has gotten bigger and bigger, namely including for someone with MS, something called JC titers for JC virus, and Epstein-Barr virus is very important. Most MS patients are on medication causing immunosuppression, so they have suppression of their immune system, and we want to be careful that we're not introducing something their body hasn't seen before. I'm using right now an 18-gauge needle, although you can go all the way to a 23-gauge needle for exosomes. I will be using an 18-gauge needle if I do a stem cell procedure, because those are larger and what I want. So one would choose intranasal application when you want to get the quickest delivery to the brain. Because of the anatomy of your ethmoid sinuses and the cribriform plate there, if angled correctly, and we're going to demonstrate that, you can move right through the ethmoid sinuses and get right into the brain, across that cribriform plate where you have vasculature that carries it into the brain. You don't have to worry about the blood-brain barrier. It will pass right through that. Okay, so what I did is I just added a little bit of saline so that I can rinse our vial, make sure we've got all of our product. So specifically, you want to use some sort of aerosolizer. I like just the basic MAD. It has a lure lock that you have to use a little bit of pressure to aerosolize it. So you want to lure lock it onto your syringe. You can choose however many cc's you want to do. About 1.5 to 2 cc's per side is going to deliver a good amount of exosomes. And we're going to coach the patient through it. So we try to prevent it from dropping down the back of the throat. Then you can use, so I have a 3 cc syringe. Again, these are, you can choose the products you like. It can be done cold, or we've now let it thaw at room temperature for about 15 minutes. You can hold your nose if you think you're going to sneeze. You can stay in that position, hold your nose. While I'm delivering it, I'm going to hold one nostril.
Okay.
Believe it or not, it doesn't start right as a spray, so you might feel like a little wetness until I get good enough pressure behind it. And I'll probably do about half and see how you do. I'm going to start with the right side. Turn your head this way. So you can see here, her nose goes like this. These are her ethmoid sinuses. So I'm not going to go in at an angle like this. That would just hit the, mucosal lining, or, go into her maxillary sinus. And you also don't want to go back at an angle. That would be uncomfortable. So it's an easy fit right into the nostril. I'm going to close your nose now. 1, 2, 3, spray. You can mouth breathe if you need to. Did you feel it come up into here? Yeah, sniff up. That's good.
Let me help. I need to do it more with you on the second one.
Okay. So when I say 3, as I push,
You push,
go
I
ahead
go.
and again, like that. You can see you're wrong because you're hitting here. Like this, you're just going to go that way. You want to aim towards where their ethmoid sinus is. You want to get a good closure there. Take a deep breath in with your mouth open. And then blow it all the way out because you're going to sniff in. 1, 2, 3, and inhale. Good. Okay. Same thing on the other side, and we're done.
Easy breezy.
So when we're treating intracranial issues, usually people have already had a lot of testing done. We know what's going on. It's rare that we don't know what's going on. So they've already come with a diagnosis, and I may ask them to do an anti-inflammatory diet, do some things that will help their body to accept the treatment better. A lot of times with acute injury, you want to just get them in. And so the fertile ground isn't as important as getting it in, let it start the anti-inflammatory process, and then we start high nutrients. And you can do that with IVs or diet and IVs. When you decide that you're going to do an intranasal delivery of exosomes or another cellular product, you really want the airways, the nasal passages, to be able to get it to where you want it to go. So if someone has, completely blocked up sinuses, I might not even choose that delivery. If they have a huge break in their nose and they're very swollen, I probably wouldn't choose that delivery, at least not right away. Once we know that someone is breathing through their nose, then I will ask them for 24 hours not to use anything such as a decongestant, any nasal sprays, anything that could irritate the mucosa that would make the product burn or have problems. Anything, allergy medicines, things that people are usually using for their nose. We just want it to be a clean mucosa, so we can go right up through into the ethmoid sinuses. In this scenario, we talked before about a lot of other things people have to stop before doing, say, a hair restoration, but those all had to do with bleeding. So in this case, we're not worried about that at all. So if someone is very symptomatic with brain fog, blurry vision, acute accident, acute trauma, they may notice within 24 hours things starting to calm down. When someone has a chronic disease that is degenerative and very insidious, where you're not noticing the day-to-day change, but with something acute, they're going to start noticing that right away. And we've seen those changes on something called a WAVI brain test right after an intranasal delivery. Nowadays, they're doing a different type of a spectrometer looking at the different areas of the brain that are responding to whether it's exosomes or stem cells. But these products are miraculous. They know where to go and they start working right away. And it's like we're working with our own body's little healing process. We're just delivering more to a brain that's in trouble. And you have been in an inflammatory state for quite a long time. You have chronic inflammation. So it may be working right away to start calming that down, and you may be sensing that. You may not see major changes on an MRI, but what you will see are cognitive changes that are reported by the patient. So less brain fog, better word finding, less slurred speech, maybe changes in vision, the cognitive functioning, the emotional impact, because, right behind the cribriform plate, we have the pineal gland, and right behind and above that is the hypothalamus. And behind that's your amygdala, which is your emotional center. Then it goes up into all your executive functioning. So as this travels now through the brain, it's going to affect every aspect. Exosomes will still work their way in where there's been a lack of blood flow and start building angiogenesis, getting more blood flow to it. So there's a lot of benefits, but I like to hear from the patient. It's very case dependent. Anything that's causing inflammation or injury in the brain, this would be a very good treatment. If they had a neurologist or a parent or something that said, I don't believe in this, I don't want to do it, I wouldn't do it. Even if they came to me and you have to have everybody on board. But this is not a dangerous treatment to do at all. There's nothing harmful other than the infectious agents we discussed earlier, which are being tested for, and there are no guarantees that something else might not pop up in the next 20 or 30 years. Exosomes and the things that our body creates, they know what to do. You put them into this injured environment that needs help, and they go to work. Okay, so you remember,
What we did.
I'm going to cover one side. You're going to take a deep breath in. When we say 1, 2, 3, go. Oh, wait, you have to exhale.
Exhale.
Then 1, 2, 3, you're going to sniff in through your nose as I deliver the product. Okay, but for this side, I just need you to turn this way because I'm going to block you here.
Okay.
I'll come this way. Okay, let me get it in.
Yeah.
Hang on. Okay, deep breath in, deep breath out. And ready, 1, 2, 3, sniff. Good. That was half.
That was fine.
In the vial was about 1.5 cc, and then I added about 0.3 of normal saline. So it was close, 1.8 cc's about. So now we're down to 0.7. The key as the administrator is to get your angle right and to get enough force that you're actually aerosolizing it. If you're not pushing fast enough, it just drip, 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 and it's not getting up. Okay, I'm going to close. You're going to breathe in and out through your mouth, in, all the way out. And ready, 1, 2, 3, sniff. Treatment completed. So take notes on how you feel,
Yes.
how you wake up in the morning, how you sleep. If you notice anything in your breathing, remember your eustachian tube is in the back of your throat. So sinuses sometimes will drain down there. So if you get your ears popping, anything like that, just take little notes and we'll just see how you do. Post-treatment recommendations, I guess is how I would say it when you're doing an intranasal delivery. of a biologic is to just be good to yourself. Don't go out partying and, putting other things up your nose. For 72 hours, you're not going to use any nasal sprays, decongestants. You're going to let it, absorb in. When you use a decongestant, it collapses down and spasms all of your mucosal lining and all of the vasculature. So it's not going to flow. It stops flow. It also stops mucus, but we want everything flowing right now through. So if someone had certain medications, I might, ask them to hold off on that. But most things are fine with intranasal delivery. You can sleep normally. You don't have to sleep sitting up. So it's if someone say a swimmer, I might say don't swim for 24 hours because when you're breathing in the pool, water can get up your nose, that kind of stuff. I recommend highly that they are doing hyperbaric oxygen treatments in conjunction with this, maybe a repeat of this in a week or two. They can also do other things such as infrared sauna, anything that is improving metabolism. All these things that exosomes and cellular products can do, they require energy. So red light can help, especially infrared, if that gets a little bit deeper. We're not worried about, your classic red light for, say, a face is good for collagen synthesis and blood flow, but we're talking anything joint, bone, intracranial, you need to have infrared light, a very advanced photobiomodulation bed, combined with hyperbaric oxygen therapy, combined with peptides. Now, there are very specific peptides that I recommend on my protocol, things that have been studied, such as VIP, thymosin alpha or beta. Those are your anti-inflammatories. There's several on my list, which if people are interested to know that, they just need to understand how they work. You don't throw everything at it at once, like a fire. You just kind of, it's a stepwise fashion.